Side look, and we're going to look at the medical censorship. In Western Australia, in fact nationally across the country, some of you may be aware of an organisation that has formed called AMPS. Not only are we going to provide some commentary about medical censorship, which we've experienced a lot in Western Australia, but in fact it's occurred nationally across the country. Joining us in this stream, I'd like to introduce Dr Duncan Syme. Dr Syme is a doctor who's had 32 years clinical experience here in Australia, 26 years of which he has a skill and an art that Australia is calling out, screaming out for doctors and GPs being able to provide the service that the community desperately needs. But there's a reason why there's a doctor shortage. The reason may not be the reason that's told to you by mainstream media. I will just take this opportunity to say that for those on the stream, thank you. We have Dr Duncan Syme joining us from Victoria. He's streaming in here. We are experiencing some lag on the video, but the audio is okay. And we are going to push ahead for this. So we apologise firstly for yourself, Dr Syme, but also those watching. I'm sure it's more what he's saying that is probably more of importance. We've been fighting a few tech issues all morning, and we've sort of tested that and we've had everything working fine, and now all of a sudden we just get these little lags. So on that basis, I'd like to introduce Dr Duncan Syme to the conversation. Thank you, Dr Syme, for joining us, and welcome from Victoria.
All right, thank you for having me.
And I guess I should premise by saying that the title Dr Duncan Syme is one that you've earned, but there is, under current conditions, you need to announce a disclaimer. Is that right?
Yes. So as you correctly, with your introduction, you've told that I've been in clinical practice for 34 years, and 26 of those as a general practitioner. But I'm currently suspended by AHPRA and the medical boards for the writing of medical exemptions in the COVID-19 period, and I'm effectively unable to practice as a health practitioner at this point in time.
The amount of communication between yourself and AHPRA or registration board that led to your suspension, when did it first kick in?
So clearly the exemptions became an issue around September 2022, when the mandates were put in place by state governments all around Australia. And in the course of my medical practice, now I was actually working in a program called Hospital in the Home, which is within a public hospital setting. But I was contacted by a young couple who were very concerned about getting the injections. They'd seen a family member who had been severely affected by their first injection and ultimately was diagnosed with myocarditis. So they'd done a lot of research into the potential adverse effects and the fact that many of the long-term, medium-term and long-term effects of the injection were not known, and there was very limited information about its effect on fertility, breastfeeding, etc. And they were planning on starting a young family. So they were not at all keen on having the injections, but they realised if they didn't have the injections, they were then going to lose their livelihoods and lose their house. I subsequently said that I fully understood their views. I read the applications by Pfizer and AstraZeneca to the TGA and confirmed that all their concerns were valid, that there were many unknowns about the injection, and you looked at the risk of, their risk of severe injury or death from COVID was very, very small statistically. So I wrote them a supportive exemption letter, which was then, their employers denied them the exemption, but they used that letter subsequently to go to a family wedding, and it was the owner of the family wedding venue that reported my letter to AHPRA effectively. saying that what I'd written on the letter, which was essentially facts taken from the applications to the TGA, was anti-vax. And subsequently, after some to and fro discussions with AHPRA, I was suspended. I said that I was not prepared to, I thought I was doing everything appropriate for, and they were under severe psychological distress about being forced into a medication, an experimental medication, and that I was acting appropriately.
So just hearing that particular story there, Dr Syme, it should be no surprise that people would expect a medical practitioner, a GP, to take an individual viewpoint of a person's treatment. Yet it seems that AHPRA, because you've taken that view, as you've just outlined, have deemed that to be anti-vax. Of course, has led going forward, you've now are part of, you're the treasurer for AMPS. Just tell us a little bit about AMPS.
So AMPS is a new professional society. It was formed towards the end of 2021, and it was essentially formed by a group of doctors who were deeply concerned by the lack of, I suppose, effective leadership by the rest of the colleges and other professional bodies within Australia, who weren't prepared to stand up to the government policies and messaging. And I felt that really that there was an alternate view, and that wasn't being represented by any official body. So it was formed after, I suppose, a serendipitous meet between the people who run Red Union and some medical doctors, and subsequently we're I suppose effectively a competitor to the AMA. As a professional body, we're steadily growing, and our goal is to basically get government out of the doctor-patient relationship, bring back informed consent, and bring back proper scientific debate, because we feel that there's been incredible censorship, both in the mainstream media and through the medical media, and that really we've only seen one side of the story. And that is very bad for making any form of policy and health decisions.
You've mentioned political intervention or government intervention into the way that doctors can treat their patients. Now recently, and I know that you are aware, that Senator Alex Antic actually took up the doctor-patient relationship in federal parliament. In fact, I would just like to play that package now and then get your comments in relation to this.
The complaint I hear from doctors routinely is that AHPRA has now fundamentally damaged the doctor-patient relationship by centralising control of COVID management with this so-called position statement on COVID, the 9 March statement. First of all, why did AHPRA see fit to do this now for COVID when it has never done it before? And I want to ask you some further questions about the position statement as well.
Thank you, Senator. So I want to start my comments by acknowledging the extraordinary work that registered health practitioners have done across Australia in relation to the COVID-19 pandemic. The joint position statement that was issued in March 2021 was actually issued by AHPRA and all the 16 national boards, so it's not just a view from AHPRA, it represents the view of the boards for all the regulated professions in Australia. And it was in response to queries that they were receiving about practitioner obligations in relation to COVID-19 vaccination, and that was a time when a number of jurisdictions were also putting in place requirements around mandatory vaccination. The statement essentially aims to make clear that how national boards are applying existing regulatory frameworks in the context of COVID-19. So I think it's important to emphasise what the obligations in that statement were not new obligations. They are obligations that are entirely consistent with the code of conduct for each of the 15 national boards, and they obviously predate the pandemic. But at the core of that was an expectation, as it has always been, that health practitioners would use both their professional judgment and the best available evidence in practice, and that included providing information to patients and the public on things like social media. So,
can I just stop you there? That's not how it rolled out in practice, though, was it? Using a professional judgment. Many doctors tried to use their professional judgment with respect to concerns raised about the vaccines and their safety and efficacy, which we now know is a nonsense. And in so doing, incurred the ire and the wrath of the regulator, and many have been deregistered for doing so. So my question to you is, do you accept that that position statement has disenfranchised large elements of the medical profession and forever damaged the doctor-patient relationship?
Senator, I think it's important to separate.
Well, no, that's a question. So the question was, has the doctor-patient relationship been fundamentally damaged?
So what I think is important to clarify here, Senator, is these extraordinary claims that AHPRA is actually deregistering or threatening to deregister doctors and other health practitioners who raise concerns about COVID-19. And I think the first thing to say is that, in fact, AHPRA and national boards have no powers to deregister under the national law, cancel the registration of any health practitioner. That is the decision of an independent state or territory tribunal or a court. It's only the case in very serious matters, and each case is decided on its own merits. And I can tell you today, to date, no health practitioner has had their registration cancelled in a tribunal in the jurisdictions in which we have responsibility for because of the views they've expressed about COVID-19.
So Dr Syme, I guess there's a couple of questions that come to mind for myself, and this is a discussion. You are a person on the inside at the coalface that is currently in limbo because of the suspension. We've just heard Martin Fletcher just then, his view is that AHPRA are not interfering with doctors and not deregistering doctors. What do you say in terms of the process? Is that a fair assessment of how AHPRA are employing their policies and procedures? Are they deregistering, or are they getting around it, explaining the term suspension?
Excellent question, Lindsay. Martin Fletcher's answer was typically bureaucratic. Effectively, technically, he is correct in response to Alex Antic's question, are AHPRA deregistering doctors? No, they're not. But they are effectively deregistering by using these immediate suspension powers. So, in simple terms to people, your viewers, they are acting like a policeman who has believed they've apprehended a criminal in the midst of a crime. They're then taking them into jail and throwing away the keys and not ever taking them to the appropriate adjudicator to see if they've actually got enough evidence to show their reasonable belief was correct. So, due process is being tossed out. They're not actually following the rules that were set up. So what should be happening is that if they've made the assessment that a doctor is behaving in such a horrendous manner that they're a danger to the public, to form that belief, they then should be taking them straight to the VCAT tribunal, which is, that is the process whereby, or the group of individuals who will decide whether the doctor has been behaving in a manner which means they're a danger to the public. And then they have to then prosecute their case. But what they're doing, as I said, is they're calling these, taking the call, producing an immediate suspension on doctors who are going against the government dictates and then throwing away the keys and letting them rot in limbo. They do say you can appeal their decision, but their decision is not an actual decision. So you then have to go as a respondent to the tribunal trying to prove your innocence. And that almost never is never possible. So it then costs the practitioner a lot of money if they use legal representation, and usually then you would have to consider appealing to a higher court, which is both obviously very expensive and very stressful.
You mentioned that the cost, somebody who has a great depth of experience in terms of treating people, but it's not something that navigating this pathway, I would assume you'd have to either spend countless hours yourself trying to get the justice that you need, or that tribunal where the outcome may not necessarily be the one that would represent justice, or as you've mentioned, it would come at great considerable cost because you'd have to engage legal professionals. If you were, and I'm just saying, yeah, as an example here, because not only are we seeing issues within the medical profession that we're having now, that government intervention has prevented doctors from treating their patients, if you were to engage a legal practitioner to mount or rebut the suspension, do you think you'd be able to find a legal practitioner willing to take on this matter?
Well, that's, again, a very good question, Lindsay. There seems to be a great reluctance within the profession to take these cases. The medical defence organisations that you would expect should be defending doctors in these circumstances are very reluctant to take on AHPRA. Now, there may be a variety of reasons for this, but one of the reasons is that they actually feel that they're essentially wasting money on this process. They've got no bigger money at stake because invariably these doctors have not caused any patient harm. This is purely a bureaucratic process. So the medical defence organisations and their underwriters say, well, all we're going to do is waste money, but there's nothing much at stake other than the doctor's reputation and livelihood, but we're not responsible really for that. So in my particular case, once I said I wasn't prepared to bow down to AHPRA and the medical boards and say that I was wrong and I didn't know what I was doing, and they basically immediately removed. They told me that they would not defend me at all.
Really is Pandora's box, because you would have, as most professionals would have, you would have indemnity insurance that you've been paying. I would suggest, sizable contributions to having, this indemnity insurance for matters like this. And then all of a sudden, when you actually really need it for an administrative process, not in terms of a treatment plan, because there would be no argument, your treatment plan for the patients that you mentioned was the right treatment plan for those patients. So you're fighting an administration ruling here that's determined that that treatment plan is anti-vax. So now you find all of those premiums that they've taken willingly from you where do you go from here? I just don't know.
This is exactly right, Lindsay. Fortunately, I was already with AMPS. AMPS they've got a branch in the organisation that is prepared to fight AHPRA, and so they've taken up my case. But for many who weren't with AMPS, they are left bereft, having to fight on their own. Occasionally, if they were very savvy, they may have, before they've actually got too deep in with their medical defence organisation, they may have to have their case funded by the medical defence organisation for a private lawyer, which can be done. But the medical defence organisations are generally very reluctant to take on these administrative cases because they don't feel there's any sort of major financial risk, as opposed to, say, having a patient sue you for some form of medical negligence where the cost to the organisation may be in millions of dollars. There is no actual sort of monetary cost at risk for the organisation. So again, there's a major problem with the legal profession being prepared to back up doctors.
I just want to come back to Senator Alex mentions the position statement, the 9 March 20 position statement. And AHPRA, Martin Fletcher refers to that as well. And it talks about that AHPRA are simply asking doctors to abide by the policies, guidelines and procedures that doctors have agreed to in order, for their registration. Now, within that position statement, it mentions the Australian Immunisation Handbook, which I'm sure that you and all healthcare professionals, doctors, nurses, etc., would well know, Dr Symes. It's in the guidelines in that handbook, which we'll bring up on the screen now, where it states the requirement between a medical practitioner and the individual whom's about to receive a medical treatment of an inoculation or an injection. It can be seen looking at that part in the handbook that I'm talking about valid consent. Now I'm going to bring up what I'd call is the nuts and bolts of the valid consent, being the criteria for valid consent, and I'm going to bring to your attention, those watching at home, point number 2, where it states that a vaccination must be given voluntarily And it also must be given in the absence of undue pressure, coercion, or manipulation. So I guess the proposition that I'm going to put to you, Dr. Symes, for your comment if you can, does AHPRA's insistence of instructing doctors to mandate the COVID-19 injection compete with its own position statement that you must adhere to valid consent as contained within the Australian Immunisation Handbook?
Absolutely. I mean, you've got two completely contradictory statements. So you've got AHPRA essentially saying you can't say anything but positive things about the COVID-19 injection, yet in the Code of Conduct and Australian Immunisation Handbook and pretty much any ethical statement guidelines you care to look at, any offering of medical treatment has to go with informed consent, and that has to put both the positives and negatives of any treatment. It has to also involve what are the actual risks to the health from the treatment that you're attempting to protect the patient from. Yet, if you state those risks of an experimental treatment according to AHPRA, then you are at risk of disciplinary action. I mean, it's just completely illogical. So for Martin Fletcher to say that this is not affecting informed consent, I don't know if he actually said those words, but that was the, I suppose, the general theme of his response is ridiculous.
I'm trying to get my head around this, and I'm sure many people are doing this, and I really thank you for your insight here, because this is one that mainstream media won't bring. And what you're looking at is coercion. How long would it take you to decide that no jab, no job versus a patient who has a medical condition that really in any other circumstance should warrant an exemption? How do you get around yourself feeling that it's coercion?
It is coercion, and there is absolutely, coercion in multiple facets. You've got the psychological coercion through mainstream media. Then you have the coercion through employers who have been in themselves coerced into implementing these policies, and it's I mean, there's no other word for it. It's coercion. It's psychological manipulation, and then you've got the doctors who have been also, I suppose, effectively lied to, and they are then feeling compelled that they have to encourage a procedure which is experimental. Otherwise, they're concerned that their jobs will be at risk. So, I mean, the whole thing is appalling. I mean, it is fundamentally it breaks so many medical ethical codes. It's just appalling. And you're not allowed to give proper informed consent. So to be talking about all the potential unknowns. I mean, initially there was a lot of unknowns. We didn't know what the long-term or medium-term side effects of the injections were, and you couldn't comment about whether people were going to be at risk for developing cancer because that wasn't tested for, or the genotoxicity because that wasn't tested for. All these things were unknowns. Now, what I'd like to point out is if you actually give true informed consent, you would find that the vast majority of people would be going, no, thank you. And we saw this with Lieutenant Colonel Pete Chambers over in the States. Now, he was a member of the US military, and he patriotically took the injection as he was requested to do, but found he ended up getting an adverse effect of vertigo. So as a result, he then looked further into the potential adverse events and looked further into the injections and realised that there were a lot more potential adverse events from the injection, and that the overall risk to himself and to the younger members of the force was incredibly low. So he then, as one of the chief doctors in the area is working, then started to give proper informed consent to the soldiers that were coming through. And lo and behold, out of 3,000 soldiers that he counselled, only 6 decided to go ahead with the injection after he'd given them proper informed consent. And that involved, what are the risks to you from actually contracting the disease, as opposed to what were essentially the unknowns of having an experimental injection.
Before we started this stream, we had a brief conversation where you actually talked me through that story, and I've since had a look at that, and it is actually quite incredible.
I just did this in the beginning to protect my soldiers, honestly. I told the general when he was yelling at me, I said, sir, I've taken a bullet for a guy downrange, protecting him on the battlefield. We get into combat, into ambush. You think that I'm going to be worried about my career when I'll put my life on the line for something, for the same soldiers? Sir, well, I don't care. It's the policy. I don't care about the science, Doc. I'm like, well, I do care about the science, see, because I'm a doctor. Okay, now I may be a Green Beret first or whatever, a soldier first, but I'm a doctor. There's a Hippocratic oath. I do things legally, morally, and ethically as an officer. And I live by the Army values, which number 7 is personal courage, not personal concern, sir. This is a conversation I had. Same thing happened to our guys in the military. If they didn't take the shots, second-class citizens. Well, how is it that I could keep that border safe, those soldiers, when I had only 1/3 of them vaccinated? Because nobody else wanted to take it. 1/3 vaccinated. We got 20,000 people coming across a week from Central and South America and all over the world with all kinds of. Forget about COVID. That's a low-level operator. I'm talking about TB. I'm talking about some real serious things coming across. How did we do it? By using normal prevention measures that I use when I go to the Central Congo. So I just did a court case. I didn't do the court case. I testified at a court case in Tampa, Florida, United States Navy SEALs versus the Department of Defense. And that was the first person to get on the stand to support the SEALs, the United States Navy SEALs in this. And they want to know, is it safe? Are the shots safe? Are they effective? And can we do this with lesser intrusive means? That's it. Okay, first of all, they're not safe. We've proven that. They're not effective. We've proven that. Can we do it with lesser intrusive means? Yes. We need to practice good measures, just like we did before. If you got pneumonia, you stayed home. You wash your hands. You might wear a mask when you go to visit them. Okay, that's about it. We just did good measures.
What we're talking about here is an insight into medical censorship. By now, there's ample data out there. And I guess, Dr. Syme, thank you very much for your time. I'd like to end with 2 more questions to you. You've mentioned that AMPS is running head-to-head with the AMA. We certainly in Western Australia here, we're familiar with AMA in terms of the work that AMPS is doing.
So we have a Stop the Censorship campaign, and this is designed to spread the information. One, it was designed to highlight the new national law amendments that have gone through in Brisbane, but it's also designed to essentially wake the public up and hopefully wake other medical professionals up as to the severe censorship that has caused suppression of proper medical and scientific debate in this country over the COVID-19 policies and directives from the government and the health bureaucrats. So the Western Australia Symposium is part of that program. We've got another symposium happening in Sydney. We've already had a conference in Melbourne earlier in September, and we've had some regional information evenings in Victoria. Later on this month, or in early December, we're heading off to South Australia to have a further symposium there with a stop off in regional Victoria. So we're trying to spread the message about the new amendments to the national law, which we think are highly damaging, where they're putting the priority is about government messaging and confidence in the health system rather than individual patient care. That is one of the primary roles of the national law. So as a patient, your needs will take secondary priority to what the government and health bureaucrats feel as the most important messaging of the day, and then they have very grey and ill-defined wording, which sets a very low bar for doctors to cross. So in essence, you can be providing your patient with the best possible advice, but it's very easy to step into the realm of the health bureaucrat government world, which you may be contradicting some of their views or creating some degree of damage to the confidence in the system if the health bureaucrats are off the mark with their policies, which then makes doctors and health professionals very concerned with doing anything opposite to what's being told. So it's a one size fits all from the government. You're not allowed to use your discretion, your knowledge, your experience, the patient's individual needs, expectations really all come secondary to what the government wants. And they effectively are inserting themselves into the doctor-patient relationship. So this is the sort of we're trying to get out that this is inappropriate, and we as the AMPS organisation are going to be fighting this.
And I think I'll just highlight here that what you're talking about, you've mentioned Brisbane, what they're doing in Brisbane. So they've recently introduced legislation to do exactly this, taken away individual treatment plans, and it must now be for Queensland-based medical practitioners, a one-size-fits-all approach, which is set by the bureaucrats, as you've mentioned. Something that is not here yet in WA, I guess, for those here in Western Australia. And this will be something that this is part of the messaging that AMPS is trying to communicate. Those that aren't aware of what's happening over in Queensland, a very, very draconian piece of legislation, very disturbing, and the likelihood of this becoming national-wide. I mean, what would your view be on that? This
national law, in fact, is by an agreement made back in, I think, 2008 or 9 or 10 by the state government premiers, I think at COAG. They've basically said if the national law passes in Queensland, it then automatically goes into place in Victoria, Tasmania, the ACT and the Northern Territory. There has to be, and that's essentially by the health ministers just signing that act into place. So there's no actual parliamentary discussion about it. In New South Wales and South Australia, I think it has to be put before Parliament, but effectively it's the same. It's pretty much very similar legislation. And I think in WA, they have to make up their, it has to go through Parliament in WA, but they copy and paste much of what's in the national law from Queensland into the Western Australian legislation.
And I think it's information in terms of a stream that we might take a deep dive sometime in the immediate future, I guess, here at Freedom Media WA. I'd like to just end, you mentioned again, and I've said that AMPS is essentially going head-to-head with the AMA. Not all doctors would be brave enough to speak out, but that's changing as each week goes. In terms of the doctors that are joining AMPS and wanting to see this message, may not be vocal, but behind, how would a doctor reach out and be part of helping combat medical censorship?
Well, I mean, the first port of call, particularly if you're concerned, is to actually reach out and contact AMPS and look at becoming a member. The one thing that AMPS does better than any other organisation is actually it will take up the fight against AHPRA, unlike any of the medical defence organisations. It's very proactive in that area. So, and we're focusing on sort of core medical issues, which is, as I said, the doctor-patient relationship, informed consent, medical ethics. At this point, our primary focus. We're not so interested in woke topics. So that
public support in terms of because there has been a lot of people feel as though that they can't trust their medical practitioner. How can the public buy in on what AMPS are trying to achieve?
Well, they can register their support. If they've got a health or science background, they can become an affiliate member. I think that's $50 a year. Otherwise, they can donate to AMPS. Where clearly we're engaging in quite significant legal stoushes, so we're always in need of funds. So if people are wanting to support AMPS, then they can donate. I think there's some discussion about other type of affiliate membership, because we have been contacted by members of the public who are keen to see our organisation succeed, and would like to support him by sort of becoming a member. But we haven't fully worked out that class of membership yet.
We are about to end the stream, and I'd like to thank Dr. Duncan Syme, the Treasurer of AMPS, for giving us his insight. We thank you for your patience in relation to that. Tech issues that we've had, I guess what AMPS are doing, we don't have the mainstream budget, but we're simply trying to do what we can do to bring you stories like these, to bring you stories like the insight that Dr. Syme has just provided, because mainstream media won't. And that's the most important thing. So the best thing that I ask that you can do, as I do with every stream when I enter that, or when I end the stream, is say, please like and share, because by sharing streams like this is the only way that information like this can get out. And you can see and go back and watch this stream, hear what Dr. Duncan Syme, a man who is in no man's land. He's in suspension at the head of the stream. He's spoken about that. So thank you very much, Dr. Syme, for your time and your contribution to here.
As you say, very important to keep the communication going. This is about all Australians' health. It's about nobody is not affected by what is happening with the national law, with the medical censorship that is going on. We are all profoundly affected, and if they've done this medical censorship once, and they've probably done it more than once, they're likely to do it again. And it's people need to be informed to be able to make good decisions about their health, and they need to have both sides of the story. Almost every treatment that's out there has pros and cons, and it's disingenuous to say that there is only one side of the story. So, and that has been clearly suppressed by the government, the health bureaucrats, the mainstream media, the medical media. Unfortunately, many doctors who take most of their information from the conventional medical media, which is heavily funded by the pharmaceutical industry. They're just not aware of the other side of the story. It's been very much a sort of a carrot and stick approach that the health bureaucrats and the government have taken. But we need to be as informed as possible when we're making our health decisions.
Again, Dr. Duncan Syme, thank you very much. To those that have commented on the stream, we thank you again, just renewing that call. The most important thing that you can do to offer your support is to share this stream so that this information gets out. So from myself, Lindsay at Freedom Media, thank you for joining the stream. Brought to you by Freedom Media WA, where journalism should never be a government narrative.